Thank you for joining us this evening. We're going to wait just a minute or two until we load in all of our attendees tonight. Gracias por acompañarnos. Vamos a esperar un momento hasta que todas las personas están dentro de la junta. All right, looks like most of the people have arrived. I'd like to welcome everybody. Thank you so much for joining us this evening. Me gustaría dar la bienvenida a todos. Muchísimas gracias por acompañarnos. My name is Faris, I'm the County Superintendent of Schools, and it is my pleasure to welcome you to our town hall discussing COVID-19 and schools. Me gustaría dar la bienvenida a todos. Gracias por acompañarnos a este ayuntamiento, esta junta virtual sobre el COVID-19 y nuestras escuelas. I'm going to share my screen and just do share some information with all of you. All right. So we'd like you to notice that this meeting is being recorded. Estamos grabando esta junta. We ask that you keep your cameras off and your microphones muted. Please feel free to use actually, I'm not sure, do we have the chat? Is that live, Berenice?
It is for hosts and panelists right now.
Oh, okay, so it's not for our attendees. We do have a Spanish translator, Jessica Serna Castañeda. Tenemos una intérprete que se llama Jessica Serna Castañeda. Para los que quieren escuchar la presentación en español, les pedimos por favor que toquen el icono que está en la parte de abajo de la página que representa un globo y cambiar el lenguaje a Spanish o español. Y eso les va a dar, ustedes van a escuchar la presentación en español. También tenemos toda la presentación convertida al español, así que vamos a compartir ese enlace con ustedes para que ustedes puedan seguirlo en español en su propia computadora. We've also translated our presentation into Spanish so that parents could follow along in Spanish. And so we ask, les pedimos a todos los que quieren escuchar la presentación en español. I also would like to share with you that we are going to be using the Q&A feature of this webinar. At the bottom, you'll see Q&A, an icon there. If you click on that, it'll give you an opportunity to ask questions. And we have people here who are going to be helping us answer those questions because we're going to try to cover as many questions as we received when we registered, but we know that there's going to be questions that are going to be coming up for you, and we'll do our best to answer them as soon as possible. And if we will also be providing the recording will be available on our YouTube channel, and we'll also be putting out a Q&A document. And so I'd like to give a warm welcome to a team of people that I have continued to have the pleasure of working with, our school district superintendents. They're an amazing team of leaders who have been working diligently to support our schools and doing everything they can to ensure that our students are healthy and addressing the many challenges that we face with COVID-19 and how it's impacted our schools. And those are not the only challenges we face. There are so many different challenges that we continue to work to overcome on behalf of our students. And it's really been such a pleasure to get to work with them, to learn with them, to figure out creative solutions to the many challenges we're facing. And they're here with us tonight, and I just want to thank them for their presence and their leadership. So for today, and I'm looking at my agenda in Spanish, and I'm wondering if I translated this. Give me 1 second. So it looks like I translated my agenda into Spanish, which is not good. I think it'll be fine. I'll just explain it. It's only 3 items. So we're doing introductions. We're going to spend some time talking with you about the COVID-19 protocols that we're implementing. And we're going to also be talking about some initiatives such as our effort to provide testing for students, and other initiatives that we're putting in place to keep students healthy in our schools. And then we'll open it up for questions and answers. And so that is what we're going to be working on today. I would like to share with you that from the questions that we received, for those of you that registered, there's this word cloud, and this is what it looked like. And I thought it was a pretty cool image showing kind of what are the different words that really popped out for community members and parents. Words like test and COVID and student, school, masking, vaccine. And so we created this image just to show you that how we're, what are the most prominent words that were showed up during this time. Now, I'd like to introduce our speakers who are going to be doing most of the talking in conjunction with me tonight. We're lucky to be accompanied by Anna Sutton, who's a director of nursing with the Santa Cruz County Public Health. Ms. Sutton is a experienced nurse and an amazing director with public health, and has been an outstanding partner with us in all the work that we've been doing to respond effectively to the COVID-19 pandemic and challenges that it's brought with us. So really grateful. Welcome, Anna. And I'd also like to welcome Jennifer Busing, who's our Director of Safety and our main liaison for our schools. She is many times one of the people that our schools talk to and contact when they have questions. She's our liaison with public health. And really they form kind of the conduit where a lot of the conversations take place, of course, with other team members. All the districts have representatives that we work with, and really represent an important team that helps us ask the right questions, find out, kind of get to the bottom of a situation to be able to put together a response plan to ensure that we are taking all the necessary steps and addressing any challenges that we've encountered. So we're going to start here just to share, that one of the questions we often get asked is do you really have to follow the guidelines from the California Department of Public Health? And the answer is yes, we are required to do so. They are requirements, even though they're called guidelines, and also local health orders. And one of the reasons that this has been challenging for schools is because in some cases, the guidelines are not clear, and we have to work through understanding what the guidelines mean to make sure that we have as clear a picture as possible to be able to make sure that our local protocols are clear. And this is one of the main reasons we partner with public health, because we're in the world of education. We know our schools, we know our classrooms and the protocols that existed before COVID-19, and public health, the local public health office really helps us make this understandable and ensures that we're following CDPH guidelines properly, and make sure that we are looking at the big picture. And part of the process that we've gone through has been an amazing collaboration with all of our public schools. I would say that the relationships that we've developed across this county with our school districts, our charter schools, our private schools, a collaboration that has really been very fruitful and has really allowed us to learn together, to work together, and be able to be as consistent as possible. And when there are inconsistencies, that is where a lot of times people like to compare one school to another school, or the public schools to the private schools. Why are these folks doing? And we try as much as possible, bring everybody together to find out if they're in fact following the guidance as we're required to do so. And if not, find out what we need to do to get back on track and make sure we're following the guidance. But that has brought some consistency that hasn't existed in many other counties, and it has created wonderful working relationships and supportive environment where now we're working together in a way that I think is really something to celebrate. And our goal has consistently been, or I should say, our goal has been driven by ensuring consistency and equity in the implementations of protocols. We recognize that throughout this pandemic, that certain families have been impacted in different ways and have had to overcome more difficult barriers because of the pandemic and other challenges. And it is our effort to ensure that we're providing the necessary supports to our students, to our families, and to make sure that we're doing everything that we can to help students overcome the challenges that they're facing. And you know many of the examples of what our school districts have mobilized to do when it came to internet connectivity, for example. Our county had approximately 10% of our, 17% of our students didn't have internet connectivity. With the mobilization of all our school districts and the number of devices that were given out, we were able to reduce that internet connectivity, that number to 3%, meaning that 97% of our student population within just a few weeks had internet connectivity. And that is part of our effort, right, is to ensure equity and also ensure consistency, and making sure that we are working together in the most collaborative manner is really a benefit for all our students. I'd like to ask Anna Sutton, who's here from Public Health, to give us an update. There have been some good news about the community numbers for COVID-19, and we'd like to talk a little bit about what that's looking at like in our schools as well. And so I'm going to turn it over to Anna to give us an update.
Thanks, Faris, and thanks everyone for coming here tonight and joining us. You know, I think it's one of the things that's really hard is to look at numbers and understand what they really mean. So what I'm going to share with you tonight was also sent out on a press release sent out by the county yesterday. And Santa Cruz as a whole, as a county, both with our children and with our adults, has done better than the rest of the state in keeping these case rates really flat and low. And right now we had some great news coming out from what we call the CDC tracker. It gives us the percentages of cases over a week. And in the last 7 days, the CDC tracker showed that we had a 52% decrease in cases in the last 7 days. So that's good news for all of us, right? That's good news for kids in schools. It's good news for parents who are working, and it's good news for all of our community. And the other thing that we look at here to see just, you know, how the virus is impacting us is, are people getting really sick to the point where they have to go to the hospital? And we also got some good news there, which is we're seeing almost a 36% drop in the number of folks with COVID-19 needing hospitalization. And that's partly because people are getting vaccinated. That vaccine is reducing the severity of disease. We're just not getting people so sick that they have to access medical services. So this is all really good. And in public health, we watch the hospital numbers every single day. We get a report, and all those hospital numbers are showing people are just not getting sick like they did last year. So that's all really good news in terms of seeing numbers drop. And that has implications, obviously, for our children, because the less they're exposed to the disease, the less they can actually, they're likely to be able to transmit it. We are seeing similar trends in our schools. We were back in school for 2.5, 3 weeks. It is not a surprise that we are seeing cases. But again, compared to the rest of the state, our numbers are very, very low in Santa Cruz County. I think this third bullet here, which is hundreds of exposures, is a really important one in terms of big picture. Hundreds sounds scary, but when you think about one case exposing, 10, 20, or even like at the high school level, 150, to say we've only had hundreds of exposures in Santa Cruz County is actually a little bit of a relief. We've done very well in terms of, as soon as we identify positive cases, and big hats off to all of the school districts that have been doing this. There's been quick communication to public health, quick reporting, and really, really quick quarantining of kids and making sure that they're supported in what they need to do if they've been exposed at school. And I also want to talk a little bit about what's happening between schools and public health, because this is the behind the scenes work that most people don't see. And for good reason. We want to protect people's confidentiality. These are our little people and their families. But Faris, Jen Busing, the superintendents, and my entire team of communicable disease investigators in public health are working every single day. We're using email. We are communicating by phone. There is constant work going on every single day. And I can tell you and assure you that the County Office of Education and our school district leadership don't sit on things. They're calling us for technical assistance, asking questions. We're sending them guidance, references, and making decisions quickly that actually keep our students and our families learning and also safe. So it's been a big learning curve for all of us because we've never had to do so much work together, but it's really been wonderful. And one of the things that was a huge benefit for us was the AB 86, which is a piece of legislation that was passed, gave us both funding and sort of the motivation to come together more closely to talk about how we're going to share templates and share messaging, and also allow us to work together to open up our schools and keep our kids in school. Thanks. I'll turn it back to you.
Thank you so much, Anna. So we wanted to review some of the mitigation strategies that we are currently implementing across the county. And we're going to review some of them, and just because a lot of the questions are really about things like what are the protocols for positive cases and exposures? Is masking, is there a requirement not to mask, to mask outdoors? What about vaccination? What about testing? And we're going to be spending a lot of time on testing just because we want to be clear with you about the new testing partnership and initiative that we have in place with Inspire Diagnostics. And so this is the Swiss cheese model, which the idea of this, I think, is just to show that all of these different layers of protection, none of them are perfect, provide any kind of perfect protection against COVID-19. But working together, they minimize the risks to students and for transmission from one person to another person. And so the kinds of things that have made a difference for us and have helped us to keep our classrooms open over these last few weeks, where in other counties, we're seeing a lot of classrooms, a lot of schools shutting down, has been parents working to screen their children and keeping their kids home if they're sick. A strong collaboration with our physicians and the schools to make sure that we have a common understanding about what forms need to be used, or what making sure that we have an understanding if a physician is communicating with the school, what the direction is from the physician. The schools have been working hard to improve air quality and providing air purification to maximize clean, healthy outdoor air available in our indoor spaces. Testing, which again we'll be talking about. We've been implementing protocols for positive cases and exposures. How do you isolate? How do you quarantine? We'll be talking about that in a little bit. Of course, the mandate from public health for universal indoor masking is something that we're implementing. And then cleaning and disinfecting is something we continue to do. And then, of course, student and staff vaccination, which we will also be talking about as well. So our approach is that working together, we are doing everything that we can to maximize or minimize the likelihood of transmission and create the safest environment. But also remembering, of course, that we are wanting to keep students in school. We recognize that sending students home was not as successful as we would have liked it to be for many of our students, and that we really believe, for both social emotional growth, for educational reasons, that we want our students to be in school, for us to be able to connect with them, engage with them, help them on their educational journey, and also to support them as much as we can. And so it is for that reason that we've been working so hard to put these systems in place to minimize the risks for our staff and our students. So the first one we'd like to talk about is masking, and it is the clearest directive from the California Department of Public Health that masking is required indoors. It is encouraged outdoors. We know that some districts have decided to implement some masking outdoors as well as requiring it outdoors. And it is highly encouraged if students are on modified quarantine. And we'll be talking about what modified quarantine is a little bit later. Schools are generally enforcing the requirement that we have received from CDPH. And it is we recently received some notification, new updates that they are required for all indoor sports unless they pose a choking hazard identified by a health authority, such as the American Academy of Pediatrics. We also received some new information about masking musical instruments. They do recommend masking while playing musical instruments, and if that's not possible, they have some mitigation strategies to allow for music to be played if a student is not able to wear a mask, including conducting the activity outdoors, using modified face coverings, for example, performing weekly screenings, and including for those who are fully vaccinated. Another important effort that we've been a part of has been vaccination. And it is optional for our students to be vaccinated, but our vaccination is available for students between ages 12 and up. And we have been working hard to provide clinics. We're going to be sharing with you some information about clinics for vaccination for students. We've also worked very hard to vaccinate our staff, to provide vaccination for staff. We did receive a public health order from the state that requires school staff to be vaccinated or participate in weekly testing. And the easiest way right now, we do have some clinics that are happening on Sunday, but the easiest way right now to find that place to get vaccinated is to go to My Turn. I do want to put Anne on the spot a little bit and ask her if she could share a little bit more about why she thinks that vaccination is such an important mitigation strategy for our school community.
So with vaccination, last year when we had basically none of our kids vaccinated, we saw really, really high rates of hospitalization and medical services use. With vaccination, with our kids who are eligible at this point, if they are exposed at school and they have a mask on, and we're going to talk a little bit about this when we talk about modified quarantine, but fully vaccinated students are not subject to any type of quarantine. The other reason is the health reasons for vaccination. There is data that shows that when you are fully vaccinated against COVID-19, you are much more likely to mount an immune response quickly and not allow that virus to make more copies of itself, making you sick. Individuals also who are vaccinated are less likely, because they are less likely to get sick and have virus in them, are less likely to also transmit it. So vaccination overall, not only is it good for our bodies and just each other, but we're watching data here in Santa Cruz, which shows the difference between last year, where we basically had no kids vaccinated and no individuals vaccinated, versus this year, where we have lots of folks vaccinated. Hospital rates are way down, and so is emergency room use.
Thank you so much, Anna. It is for that reason that we continue the effort and making vaccination available for our students. So one of the biggest challenges and one of the biggest questions that we receive from our community is what happens when there is a exposure of COVID-19, where somebody who has COVID-19 exposes students and staff in a school setting. And what steps do we take to address the exposure? What happens to the students? And because I wish it was really simple and we could just say there's just these two things happen, but it is a little bit complicated. So we wanted to spend a little bit of time just talking a little bit about what steps we take to make sure that we're protecting everybody that may have been exposed. And I'm going to ask Jennifer to talk to us about this.
Thank you so much. Unfortunately, as Anna mentioned, it's no surprise that we do have cases in our school, that there have been positive COVID cases identified, because we have had so many in the community. Great to hear that number is coming down, and that we hope that the number in schools will be coming down. But as a parent myself, I know that we all have been getting those exposure notifications, and it can be a little unsettling. So I'm really excited to see so many people here, to know that there really is an organized process for how to respond. And all of our schools are doing a really wonderful job at following the guidance in terms of how to respond in the most safe manner. We have seen a lot of school-based exposures, and I know when we hear hundreds, it sounds like a lot, but the actual transmission in school, where someone has COVID and they give it to another person in school, that is extremely rare. And that is because of all of our responses and safety layers of protection that are being offered to our students and staff. So we have a process to respond to all positive cases and exposures at school. And school handles any cases of positive cases that have been on campus. And then they look to see who could have been exposed during that case's infectious period. And this process comes from all of the guidance from California Department of Public Health, and it's followed by all of our school districts in the county, as well as our private schools. And it's really helpful because it lets us know what to do if a student or staff member has symptoms, if they have close contact, if we hear that it's happened at home or in the community, or if they have confirmed case of COVID-19. And one thing that is different about schools as opposed to a non-school setting is that when we talk about a close contact, all students in the class are considered close contacts. So if we have one positive student, like Anna said, one positive student could potentially expose 150 others if they're in a high school setting and going between classes. But that comes from the guidance, and it is the safest process that we can do to quarantine everyone that potentially could have been exposed. And when we look at normally a close contact, as we know, it is someone that spent 15 minutes or more over a 24-hour period within 6 feet of a person that tested positive. And I understand that sometimes in a classroom, there might have been a positive individual, but they were sitting in the front of the classroom, and there was someone in the very back of the classroom. And parents get confused because you say, well, that's not actually direct contact, but for school purposes, that is considered to be a close contact. So schools are taking the most protective and conservative approach with ensuring everyone's safety. And again, that is per the guidance from the California Department of Public Health. And outside of the classroom, close contact is that 15 minutes for over 24-hour period at 6 feet of each other. And schools work to identify close contacts outside of the classroom as well. Outside of the classroom, when we look at who might have been exposed, that might be someone that we know traveled in a car to and from school because they're carpooling. Schools take that responsibility on to make sure that they participate with notifying those individuals, and then also public health. It could be individuals that were on the same school bus or shared the same space during after-school programming or on an extracurricular activity or sports team. So we're looking at possible exposures from any positive case on campus. And we respond to all school staff, office administrators, classroom assistants, anyone that could have shared that same space. So a lot of work is going into identifying potential exposures. And then we notify all of those close contacts, all of those parents, all of those staff members. And that's the first part, which is really the most important part of the contact tracing process, is the school's ability to quickly identify those that could have been exposed and notify them, and then notify public health so that parents know there could have been an exposure. You might want to keep your child home, or you need to keep your child home. And also sick individuals need to isolate at home. In general, close contacts, if someone's exposed, they need to quarantine at home for 10 days, and then plus an additional 4 days of self-monitoring. And then we'll get into, I know it's very confusing, this fall, there is a new concept from the California Department of Public Health called modified quarantine. And you'll hear more about that in a minute. But if both parties were masked, students might qualify for modified quarantine, which is a great way to safely keep our students attending school in person. Thank you, and we can go to the next slide. And this, I really love this because it can be really confusing because there's a lot of factors to consider when you look at a possible exposure and our response in terms of what to do with that individual case and what to do with the close contacts. So we have a process, again, that's based on the mandated guidance to respond to all positive cases and exposures. And we look at, does that person need to be excluded from school? And if so, how long? And as you see at the very top here, one of the things, the first thing and one of the most important things is to identify, was there actually exposure? Was someone in direct contact or not? And no, as you see, they don't have to be restricted. And then as we come down this chart, a lot of the questions are about, were they vaccinated? Because vaccination is going to give us that greatest layer of protection. If we look at the layers of Swiss cheese, and you can follow that down on the side where if they're vaccinated, they're going to go always over there to the no need to quarantine. And that's going to save us a lot of missed days because of that vaccination. And then we need to go to symptoms, because if someone has symptoms and they're sick, we want to isolate them from others. So these charts can be found in our guidance, and I think they're really helpful for staff and for families to really understand one, the safety and the rationale behind it, but that there's consistency in all the protocol. Thank you. And I think Anna is going to talk to us a little bit about modified quarantine, which is a little bit tricky, but I know that Anna is the expert on this.
So thanks, Jen. So before I jump into all of these bullets about modified quarantine, I'm a mom. I have 2 high schoolers, so I wanted to wrap my head around this too. And I'm a nurse and I work in infection control. And the first question I asked is, if there's virus exposure, why would I put my kid back in school? And the more I've done work around this, the more I understand this is really a cost benefit type of approach. There's really, when it comes to not being able to vaccinate our kids, because the kids are not eligible yet, we're choosing between something that's difficult and something that's better for the kids. The not having kids in school, there's just a lot of really, really harmful effects at this point. Recent data and science has actually shown us that in kids, even if they're unvaccinated, if we have a kid with a mask on, close contact with another kid with a mask on, if one of them is positive, the virus actually doesn't transmit very easily and infect the other student. So when you have mask on mask exposure, which is the term that we use now, in a classroom, we know that the risk is extremely low. There is always still a risk, but the risk is really low that those kids are going to transmit virus. And there's some data that shows that when one kid has a mask on, it reduces virus being transmitted by something like 70%. And if that second kid also that's nearby has a mask on, it adds another like 20% of protection. And so with that science, trying to really help our kids be back in school, the California Department of Public Health felt that it was a good general approach to help our kids go back to school by offering modified quarantine. So CDPH has taken this very innovative step forward, which is totally based in data and science, to offer this definition. And it is complicated, as Jen said, which is why Jen and Faris and their teams, along with your superintendents and principals, are in constant conversation every single day to try and help decipher situations in which kids are exposed. So I'm going to go through these bullets. I think you can read a lot of this on your own. These are sometimes like complicated words. It's a lot to take in, but listen, and then we can do some questions and answer at the end to try to help everybody wrap their heads around modified quarantine. And I'm going to do my best to translate this for you also as a parent. So basically, modified quarantine is a way to help kids stay in school when they're exposed, but they have to be exposed in the school setting. And the reason for that is because we need to have a more controlled supervised environment in which a teacher or a staff member can verify that that person was actually wearing a mask. The modified quarantine benefits kids who are not vaccinated, who don't have symptoms, who might have been exposed to someone in their class who ends up testing positive. Both the individual who's positive, and we say individual here because it could be a teacher, it could be a staff person, it could be anybody, right, who's on campus that they spent more than 15 minutes over a day with. If they end up being positive, but they expose a student who has a mask on, that exposed student has the chance, if they have that mask on, of being able to continue going to school, but they have to meet a few requirements. The first one, you can go to school, but you can't do extracurricular activities. And these things do include band, music, anything after school, and as well as any non-school sponsored activities, because there's still a possibility that you were exposed and we're just waiting to see if you actually have an infection. But it does allow you to remain in class. while you are going to school under this modified quarantine, you are required, and this is a CDPH guidance, when you're inside, you have to have your mask on. And then when you're outdoors, you're strongly encouraged to keep that mask on. And that includes PE and sports. During lunchtime, I know this has been a big topic for a lot of schools, especially if you've got, kids who are still eating on the school campus. A lot of schools have gone to assigned seating. And so you have to take your mask off to eat, right? So, but anytime you're not eating, we are strongly encouraging, we as in public health and the County Office of Education and educators, we're strongly encouraging keep that mask on, especially while you're under modified quarantine. While you're on modified quarantine, you also are going to be asked to test. There's a lot of questions about which tests and which tests are appropriate, and we can get to those in a little bit. But while you are under modified quarantine, which is a total of 14 days, in that first week, we're going to ask that families have the children tested immediately following exposure, and again after 5 days after that exposure. There may be additional times when we ask you to test, and that guidance will come out from the schools. And then the last bullet is reiterating something that Jen had mentioned in the previous slides, which is just like it has been with any exposure. When a person gets exposed, there's about 14 days in which we know that you're incubating virus. That's the time when you could actually become infectious. But for the purposes of modified quarantine, we say that you are quarantined for 10 days. That's the official time period. You do your testing and you remain in school the entire time. And in the last 4 days of that quarantine period, we're asking you to just be very cognizant of whether or not you have a fever or any symptoms of COVID-19. So it was a lot of information there. The slide is there. It takes some time to take it in. But the bottom line, I would say that especially as a mom, I think the thing to remember here is if you have a kiddo that's not vaccinated, if they're going to school and you can just keep them masking, that mask allows them to stay in school if they were exposed and have no symptoms. And that's really, really important. Thanks.
Thank you so much, Anna. And it is one of the most questions that we get from folks is about modified quarantine. But we do appreciate the ability for students to be able to stay in school as a result of this option. And so it is definitely something that has made a big difference for us, and why testing is so important as part of our effort to keep students in school and implement modified quarantine. So another question that we often get is about in-school transmission. And we know that if case numbers are high in the community, which they have been for quite some time, that we're going to have positive cases in school. And part of the process that public health working with our school staff conducts is to try to determine when there's a positive case, where it comes from. And I'm going to ask Jen to talk to us a little bit about that process and how it is that when we determine that there might have been in-school transmission, what steps we take at that point.
Yes, thank you so much. Like we spoke about earlier, we do have all these layers of protection, and we are seeing cases and exposures in school. And for the most part, we are able to mitigate transmission completely. It is extremely rare that we have a case in school that, like I said earlier, that actually transmits the virus to another individual in that classroom. But in those instances where it does happen, this is where I'm so appreciative of all of our school districts' relationship with public health, because when there is a case of in-school transmission, public health conducts their contact tracing, and they determine the most probable source of where is there an area where that could have occurred. Contact tracing, just to remind us all, it is a common practice that public health has used in many instances, not just in COVID, to identify individuals that have been in close contact with someone else that's tested positive. So when I spoke earlier about a whole class being exposed, a really important piece of public health's case investigation and contact tracing is looking at perhaps the seating chart and really identifying who was sitting where, what layers of mitigation could we possibly provide and recommend to each class or to each situation. There's a collaborative role with all the schools for every case, every exposure, but especially a case of actual transmission. In most cases, this transmission through public health work with case investigation and contact tracing is determined that transmission actually occurred outside of the school setting. Perhaps they go to after school care together or live next door to each other, went to a birthday party, carpooled together. It's usually not in the school setting. In those cases, when it does, we work together, we'll have a meeting and we'll work with all of the school administrators with public health and get recommendations on what type of changes could occur in the future. Many factors are considered. For example, it's sports and athletics, if it's a less restrictive or contained environment. But some of the recommendations that other school districts and other counties that they're implementing are created for each situation. So maybe there needs to be additional attention to masking. Some kids are not always as great as others, maybe outdoor. Maybe we need to have seating tarps outside at certain benches to keep kids, certain places and to help them sit far apart. Different areas, maybe they need to eat lunch at different times. There's a lot of individualized recommendations that can occur, and it is individual to each situation. Last year, it was really cookie cutter, and they said, if you have a case, you're closing the classroom. But that actually wasn't necessary in terms of a public health standpoint and in terms of mitigating the risk for transmission. And again, just want to elaborate that public health and all of our school districts in Santa Cruz County, County Office of Education, we're committed to keeping schools open. And it's the relationship that we have where we can assess ongoing trends in the community and trends in the classroom, each district, to make individualized modifications. I feel like this whole year will be about pivoting and maybe doing things different based upon what's going on in the community, what vaccine we have available, what testing we have available. Can't wait until our younger ones have the opportunity to get vaccinated themselves. But ongoing, we are committed to keeping our schools open and doing it safely, preventing in-school transmission.
Great, thank you so much. We'd like to talk to you now about the school-based weekly testing program with this, our partnership with Inspire Diagnostics. One of our school districts have been partnering with Inspire Diagnostics last year to conduct sports testing. And we approached them to see if they would be able to continue providing support for a larger number of schools through their team located at the school site. Instead of sending people to clinics, sending people to other locations, could the team come to the school site and conduct the testing at site? Now, you heard already that modified quarantine would require 2 tests a week. That's one of the requirements to participate in modified quarantine. This California Department of Public Health recommends weekly testing for both students and staff. And so when we began having our conversation with this Inspire Diagnostics, we wanted to know if they had the capacity to be able to provide testing for as many schools that were interested in signing up for testing. It's really important for us to communicate to you that participation is voluntary. Consent is required. Now, this is important because folks are sometimes ask us, why are you mandating this requirement? So the California Department of Public Health does say that if you want to participate in modified quarantine, you have to participate in testing. So there is that requirement that if you want to be able to participate in modified quarantine, you have to get tested twice a week. So this is really an option for parents to be able to choose for their children, because the alternative to that is that if you do not participate in modified quarantine, your child has to go to quarantine at home. And so, so we want to just make sure that it's clear that students are not going to be getting tested unless you consent to it. There is also the option, as communicated to us by public health, that students ages 13 and older can consent to participate in the testing program. But all parents are being notified, and that is how we want it to be. Now, unvaccinated teachers are required to test weekly. That is a public health order that we received about a month ago, and so that is something that is required. Our Inspire Diagnostics utilizes PCR tests, which are safe and effective. The CDC is going to be rolling out some newer tests very soon, and there has been some information out there about, oh, the PCR tests can't distinguish between flu and COVID-19, and much of that information, all that information has been debunked. PCR tests are designed to find the virus that causes COVID-19, and it does so, and it is called the gold standard by the CDC, by the FDA, and CDPH. There are new tests that are going to be coming out that will be replacing the PCR test, that would allow for schools not only to find out if a student has the virus that causes COVID-19, but also test for other diseases like influenza. And so these enhanced tests, they're called multiplex tests, would allow for being able to have a single test that would allow for a lot more information than just knowing if the virus that causes COVID-19 is present. The great thing about Inspire Diagnostics is they drive the samples to the lab, and so they are able to report results very quickly within 24 hours. As of this week, we have 32 schools that are signed up and participating in the program. We expect another 20 more schools to be added. So we would be at 50 schools that will be participating in this program. And you probably have seen the emails that are coming if you're a parent in your school, giving you information about the testing program. Generally speaking, the team comes in twice a week. They come to a school. They'll come either on Monday and Thursday or Tuesday and Friday. They will test half the students who have consented on Monday. They will return on Thursday and test the other half of the students. If any of the students were close contacts between that time, they would be added to the list to be tested so that they would get that second test that week. I participated and visited the school sites, both from the youngest kids to our high school students. It goes very smoothly. The students seem very comfortable. In fact, many of them share with us that they've already participated in testing with their parents in other locations. And we haven't had concerns coming from students and about the experience that they're having. And so this testing process is something that is allowing us to be able to keep our classrooms open for the students to participate in modified quarantine. So I did want to share with you, I did talk already about this, about PCR tests. The CDC is going to be replacing the PCR test with multiplex method. And I did mention already that it is considered the gold standard for identifying the SARS-CoV-2 virus that causes COVID-19. So what does this testing effort look like? So if we didn't have anything, everybody would have to quarantine to home if they're exposed. That would mean basically every classroom that has a positive case would have to go home and quarantine for 10 days. We started a process where we were requiring testing for unvaccinated staff, as is under the public health order. This is phase 1 on the top right corner. And students would have to quarantine if they're exposed. Phase 2 is an effort that we implemented early on, where we started using antigen tests, which are the rapid tests. They're not as accurate as the PCR test, but for students, but they do count as, and they give you results in 15 minutes. They even though they're not as accurate, they are an option for that. The problem is that the California Department of Public Health no longer has antigen tests available for the schools. They were giving them to us in large quantities to be able to test every single close contact a student would have so that we can make sure that they weren't developing COVID-19 symptoms and did not have a viral load that would give them a positive antigen test. And we we launched a drive-through location at Cabrillo College, which we'll be talking about. We are now entering into phase 3, which is weekly on-site PCR testing for all willing people who've consented, people who are vaccinated or unvaccinated, and it says vaccinated, it should say unvaccinated, students and staff. So people can opt in and consent to participate. And if they've been exposed, if there have been close contacts with a positive case, they would get 2 weekly tests as part of the process to allow them to participate in modified quarantine. We now have 2 locations. We have one at Cabrillo College, and the Pajaro Valley Unified School District just opened up a second location at the district office. So just to give you a little more detail about the availability of these programs, testing is available to the school community. And when we say school community, we're talking about students, we're talking about their families, so parents, siblings, other relatives, staff, and their families. And so, they're available, they're free, they take place outdoors, they're in a drive-through location, so you remain in your car. They're very fast. People usually don't take more than 5 minutes to go through the process. And the report is usually received, the results are usually received within 24 hours. So the first location that was launched is at Cabrillo College in Lot K by the pool, Monday through Friday from 3 to 6, and Saturday from 9 to 5. And so we've expanded the hours because of the demand was so high. And PVUSD launched their testing location at the district office parking lot Mondays, Wednesdays, and Fridays from 9 to 5. And so we have lots of options for students to be able, for families to be able to take their children. And if a child has symptoms, it's often difficult right now to find a place that will take a symptomatic child to get tested. And that's why we wanted to put this in place to support students and families to be able to have a place you could go and get results quickly. Because if a child is symptomatic and they get a negative COVID-19 test, once symptoms improve, they're able to go back to school. They don't have to isolate because we have a negative result that shows that they don't have COVID-19, and that we just want their cold or whatever it is that's causing the symptoms to improve so that they'd be able to go back to school. All right, so we also have vaccine clinics that are available, and so we work closely with public health, and we're continuing to offer school-based vaccine clinics. This Sunday, we're going to have a vaccine clinic at San Lorenzo Elementary School and at Pajaro Valley High School. They're going to be taking place from 11 to 4 o'clock. We estimate that about 60% of our 12 to 17-year-olds are vaccinated. And though vaccination has slowed, the concerns of, as a result of Delta and the increasing numbers that we've had over the last few weeks have increased the demand for vaccination. We're looking forward to when we receive the authorization to be able to vaccinate students 15 to 11-year-olds. We understand that the emergency use authorization could be approved sometime in late September and early October, and that we would be able to move forward with vaccination of our younger students. And so one of the common questions we receive from folks is, why aren't we requiring vaccination for staff? Why aren't we requiring vaccination for students? And I wanted to answer that question. One, until recently, when the FDA authorized the fully approved the Pfizer vaccine for 16 and older individuals, under the emergency use authorization, it is more difficult to require the vaccination for individuals. And so for many districts, they were waiting for the moment for the FDA to fully approve the Pfizer vaccination to be able to move forward with requiring it for staff. And so it is something that is for discussion for us. If we don't require it of staff, staff are still able to participate in a weekly testing program. And so that's where we're at. The idea of requiring students to get vaccinated, I think that would be something that is probably even less likely to happen, but possibly something that would be for discussion for the school boards and superintendents. But at this point, none of the districts in Santa Cruz County are considering requiring it. I do want to point out that, as we described earlier, that even with vaccination, we still have folks that are getting COVID-19 and may pass it on along to others. And so it definitely protects the students and, well, it protects individuals who are vaccinated, and it minimizes the likelihood of more serious symptoms as a result of the hospitalization and death. But it doesn't eliminate anything. It is like that Swiss cheese model. It is just one of the many mitigating factors that helps us and reduces the risks for everybody involved. All right, we wanted to share with you some, just a link. You'll get it when we'll send you a link if you put a password in the email in your registration. We will be able to. We're going to send you a copy of both the English and the Spanish copies of this document, and you'll have links to the health guidance from the California Department of Public Health, the COE school guidance, of which it's based on, a return to school form after illness, and some frequently asked questions about testing, which is something that is people are asking a lot of questions. Are these required? A common question that I see being asked by folks is about wanting to see data for all the districts broken down by schools, broken down, and you know, one of the things that we are working on is to create a countywide dashboard so that people could see the trends of what's happening across the county, and that is something that we are planning on developing and putting out, and also sharing if there's been in-school transmission or not, and how much of it there is. Because one thing I think that is going to be reassuring is with all the positive cases that have existed in our schools, that are reflective, virtually all of them are reflective of the positive cases in our community. The number of in-school transmission cases have been very, very small. And so I think that it would be good for the community to see that students getting COVID at school is extremely rare. And that's because we're working so hard on all of these mitigation strategies. It's minimizing those risks for students. So we are looking at developing a countywide dashboard, and hopefully we'll have that ready for you. We're working with public health to get that data to be able to share that with you and put it on our website. So that's something that will be coming hopefully very soon. I think I've gotten to I want to see if Jen and Anna, are there any questions that you haven't been able to answer, you know, by typing that you'd like to pick up right now?
Yeah, this is Anna. There's a lot of questions, and I'm going through them as fast as I can and trying to put answers in and also references so folks know where we're getting the answers. But there have been a few people that have put in questions around school closures. And I just want to make sure folks know that recommendation is not set locally by the County Office of Education or by Public Health locally, that there is a school closure determination that was set at the state level. And when a school gets to that threshold, you can be assured that the County Office of Education, the superintendents, the principals, and Public Health will all be talking with each other to look at whether that is the right decision for the school or not. So that there is a standard that is set. And I just couldn't catch the questions fast enough to put that reference in.
Thank you, Anna. Jen, any questions you'd like to call in the air?
Yeah, that was exactly what I was going to address too. I appreciate everyone's questions there. Thanks, Anna, for getting that one.
So there's been some comments about children not contracting or transmitting the COVID SARS-2 virus, and that's not the data that we are familiar with, and that we see that is not accurate. And in fact, looking at the data across the country, we're seeing increasing numbers of younger people who are contracting COVID-19 and are transmitting it to others. And so, so that is one of the reasons why we believe wholeheartedly in following these mitigation strategies to ensure we're keeping students safe. Well, I think we should continue trying to answer some of these questions if we can. There was a question about QR codes, and this is a common question whenever anybody uses QR codes. So a QR code is basically a web-based identifier. So instead of having, let's say, a number or a code of some kind, you use a QR code because it is visually, you're able to link to a person's record by scanning it. And so a QR code can have a lot of information or very little information. And generally speaking, the QR code that is being used with Inspire, actually not generally speaking, specifically, is basically only to identify the students. It basically has the student's name and date of birth, and that's all it does. It then links to the student's ID in the data system to allow them to be able to link the sample that they're collecting to that record. So there is no other information in there. It is part of their data system, just like the schools have their own data system, and it is protected by HIPAA and FERPA, and is not shared with others. Can we opt out of weekly PCR testing? So a question is, how can we opt out of PCR testing while still allowing on-campus testing to return to class? So I'm not sure. So the only way to stay in class if you've been exposed is if you have you've been tested twice after an exposure. Twice a week, at least twice a week, and that's the recommendation that we're following for students that have been exposed to be able to participate in modified quarantine. So I think that the question is saying, is it possible for a student who is not participating in the weekly testing, can they participate in exposure testing? Meaning, can we test them if they've been exposed without them doing the weekly, the ongoing testing? And I think that is possible. I think that you would still have to sign up with the Inspire Diagnostics, and then the child could participate in two tests a week, because the folks are going to be on site for 2 tests a week and not participate in the weekly testing. We'd have to look at that, just because it would mean that student would be kind of in a special category. But it does require consenting to participation with Inspire Diagnostics for testing. And if you choose not to participate in testing at all, you would the student would have to participate in would have to go to home quarantine, would not be able to do modified quarantine and stay in school. A lot of questions on data, and we are going to be trying to provide you some data at a countywide level and tell you what we're learning from it. There's a question about improved air quality. Are there plans to measure CO2 levels in classrooms during the day to see if air circulation for each room? So a lot of work has been done by our schools over the last year and a half to improve air quality and make sure that our filtration levels are up to the high standards set by the California Department of Public Health, which is the MERV 13 filtration levels. And so the part of that process of making sure that we are up to that standard does require a variety of tests to ensure that we're keeping track of the filtration levels in the classroom. And we are expected to maximize outdoor air and outside air from the outside. And we're also expected to make sure that we are checking on an ongoing basis on the filtration and maintenance. And the districts have been deeply committed to making sure that that's taking place. I'd have to talk to them about specifically about CO2 levels if that's part of the process for maintenance, and we can get back to that answer at a later date. Another question about what is the numerical point at which school sites and districts will close down, and I believe we tried to explain that before the California Department of Public Health had set some parameters, percentages and numbers about when you would consider that. And it's now a much more localized decision. We would be working together to determine if, in fact, closing down the school would be in the best interest of students. Now, the fact that our in-school transmission rates are so low is really something I think that tells us that closing down the school would not necessarily improve the situation for most students, because if there's, let's say, lots of positive cases in a school site, and the likelihood based on our current experience is that they're not getting it from each other, then sending them home is not really going to help the situation. Chances are the majority of those cases came from the community. And so it really doesn't make sense. It's not in the best interest of students to close down the schools. And so I think that we're going to have a high threshold for that. And we will have the discussion. It is definitely a school board, school superintendent decision with guidance from public health and with guidance from the county office, whether they want to make that decision or not. But we are, as we've said multiple times, deeply committed to keeping our schools open and keeping our students healthy. And so we see that as something that, unless we absolutely have to do it, we're going to continue implementing these mitigation factors to make sure that we don't have to get to a point where we need to close down our schools. So we are getting up to our time, and most of these questions are in fact ones that we are going to be going through and answering and communicating to you. One question is, how many staff are not vaccinated? The last count that we had, and we think the number is now higher, is that 92% of our staff are vaccinated, meaning that there's 8% who are not. However, since the requirement from the state that teachers and staff have to get tested weekly, we saw an increase in interest from that 8% to get vaccinated. And so we think that number is smaller now. But we've been saying 92% just because we don't have a good sense of how much information, how many of that 8% has gotten vaccinated. We were able to have a really good sense of that number because we were so deeply involved in the vaccination effort early on, and so we were able to keep a good sense of how many of our staff were actually getting vaccinated. Question about when the weather. Right now, a lot of people are eating outdoors. What's going to happen with meals? What happens when it's going to start raining? How are we going to be able to help students be able to eat outdoors? And we are definitely looking at those possibilities of what are the kinds of things we need to put in place so that students can be able to eat, with maximizing distancing, maximizing airflow, and whether we're able to have a small number of students in a classroom and kind of with spaced out, and have some students outdoors under some sort of structure that would protect them from the weather. Those are definitely questions that we're having about in preparation for the colder and wetter months. Is there a possibility of requiring vaccination for staff? So I believe we discussed that one already. Question about being disinfecting. We do think that it is recommended that disinfecting happen, or cleaning happen daily on a daily basis. So one question is, how does close contact being 15 minutes still apply? So the requirement for a close contact with COVID-19 is if you spend 15 minutes or more within 6 feet and over a 24-hour period, then that isn't considered a close contact. And this is a common question. I am going to put Anna on the spot for this. So why with Delta, we haven't seen a change with that says that it's a shorter time frame or a bigger distance? Why are we still using that metric that CDC and CDPH continue to use?
Oh boy, Faris. I don't actually have a good answer for that. I've asked that question myself. I think a lot of it is based on studies right now that show how long virus particles can actually stay airborne, and also distance-wise. And we don't have any other. It's a very conservative way to gauge and have a cutoff. So that's why that standard is still here. And I'll be honest, I don't have a great answer to that. I think more science is coming out about that right now. But right now, the public health follows, unfortunately, what the CDC and CDPH is saying as a guideline. We have to have some sort of parameter in which to define close contact. So I apologize. I don't have a great answer for that right now.
I was looking forward to the day that I could stump you, Anna. Thank you for your honesty and for describing that. But it is the standard that we are using because it continues to be the CDC standard and the CDPH standard, and so it is it doesn't have to be. There's a question here about what about outdoor contact? Generally speaking, you know, the close contacts that we as Jen explained, when we're looking at the classroom, even though students there may be more than the 6 foot distancing, the fact that they're together for a longer amount of time makes us believe that that should be considered an exposure, and that is CDPH actually supports that. And so when you so this is not an exact kind of, you know, like something magical happens at 6 feet. And so being close with somebody for a significant amount of time, you know, definitely if at any point the masks come up, you know, the schools are looking for, if they're aware that there is close contact and one of those people was a positive case, then they would definitely consider that student or that individual a close contact. And so, but it isn't an exact science. We use that metric because we've been using that consistently, but I think that we also have to understand that there could be situations where somebody could be a close contact where the distance was a little bit more than that, or the time was a little bit less than that. So we do definitely use that and do our best, kind of make our best, take our best conclusions to be able to determine if somebody is a close contact or not. All right. Well, I think that. Oh, please go ahead, Anna.
I was also going to say, like, you know, 6 feet in 15 minutes, if you've ever stood apart from someone 6 feet, it feels close versus 10 feet. And so some of this is also a behavioral human behavior kind of a thing. And if you ever time yourself standing 15 minutes with somebody, it feels like a longer amount of time. So I think you're right when you say that it's not an exact science, but 6 feet 15, it gets us into the realm of being closer with more sustained contact. And it also depends on whether you're inside or outside. That makes a big difference as well. So it's a really, really good question. And I'm glad that people are asking and thinking about this.
Okay. All right. Well, folks, we have a lot of questions, 208 that we have to answer. We've only answered 52. And so we are going to do our homework and do our best to be able to respond to these questions over the next few days and get them to you. We're going to be sharing a document. We have your emails. Hopefully when you registered, you put in your email. So we'll be able to email you the slide decks in English and in Spanish. We'll a couple of the documents like the FAQ and our responses to the questions as well. So I want to thank you for your participation with us today. Thank you for your patience, and thank you for engaging us, for asking these questions, and allowing us the opportunity to answer you as best as we can. I want to thank Jennifer Busing and Anna Sutton and all our superintendents. Thank you so much for joining us this evening. And we look forward to seeing you the next time, because we're going to be having these on an ongoing basis. And we want to thank everybody for participating in the community, participating with us tonight. Thank you so much, and good night, everybody. All right, so I think I'm gonna stop recording.